Today we'll discuss the most common condition, frozen shoulder. Most of you would have heard of this condition. It's called frozen shoulder. So I have a frozen shoulder problem. What exactly is this condition? Frozen shoulder, also called adhesive capsulitis. In this condition, patient present with pain and stiffness of the shoulder, of the affected shoulder. So the most commonly affected age group is between 40 and 60 years of age, and 10 to 20% of the patients are diabetic, and most commonly women are affected by this condition. So what do they present with? Frozen shoulder. So what exactly happens in this? In this condition, the capsule of the shoulder joint through which the ligaments, everything is attached between the glenoid and the humeral head, gets thickened and inflamed. So that's why patients present with pain and stiffness of the joint. So what are the signs and symptoms of this frozen shoulder or adhesive capsulitis? It's divided into three stages: freezing stage, frozen, and thawing. In freezing stage, this stage lasts somewhere between 6 weeks to 9 months, in which the patient presents with pain, severe pain, and once the pain is there, the patients tend to rest that joint, so eventually it leads to stiffness. In frozen stage, what happens? Pain gradually comes down, but the stiffness of the shoulder increases. Patient will not be able to move much. And in thawing phase, pain also comes down, and movement, it gradually improves, but not completely back to normal. Coming to the treatment, so what are the investigations is routinely suggested. So basically we do X-ray to rule out the other causes of frozen shoulder, and MRI and ultrasound. In some patients there will be associated rotator cuff tear. To rule out that, we do MRI to know whether the cuff tear is there or not. So once the diagnosis is made, so the treatment starts initially with analgesics and anti-inflammatory, and then even the steroid can be injected. So, and in the later stage, if the movement is not there and shoulder is very stiff, we do a treatment called manipulation under anesthesia, where we mobilize the shoulder joint completely and get the full range of movement. And after this, the main treatment lies with the patient's hand. Physiotherapy and range of movement exercises post manipulation and anesthesia is the key to this treatment. One more treatment is arthroscopic capsular release, where we release the tightened capsule. So after that, again physiotherapy plays a main role in this treatment. Initially, any patient who is having these kind of symptoms, that shoulder pain, and who is diabetic, it's better to start shoulder mobilization at the earliest. In spite of having pain, it's better to move your shoulder rather than to go for stiffness and going for a surgical procedure. So prevention is always better than cure. So it's always advisable to do the range of movement exercises in case if you develop shoulder pain, after ruling out the other causes of the shoulder stiffness and the shoulder pain, like rotator cuff tear or fracture or calcific tendinitis. There are n number of conditions which can cause the shoulder pain. Once all these things are ruled out and the diagnosis is made like frozen shoulder or adhesive capsulitis, so the main key to treatment is physiotherapy and range of movement exercises. So once you do exercises and keep ice packs, your pain will come down and you will gain the maximum functional range of movement. Thank you.